Hey guys, welcome back to my channel. So if you don't know me already, my name's Celine. I'm a 5th year student doctor at the University of Cambridge and I'm also the founder of MedCell Academy. Welcome back. If you don't know who MedCell Academy is, we are an online tuition platform that provides affordable and high quality education from Key Stage 3 to GCSEs, A-levels, all the way up to medical and dental school entry. So if you want to put any of these interview tips to use in those medical and dental interviews, just send us a message on @medcell.academy and we'll get back to you as soon as possible. But for now, let's get straight into the video. If you've seen my video on confidence and my top 3 tips on how to appear more confident in your medical and dental interviews, then you know that having a good conclusion is actually a great way to end your answer on a confident note. A lot of students get quite nervous as they approach the end of their answer because they don't really know how they're going to end it. Chances are you are ending it in one of 3 ways. You are giving a great conclusion, a one-line summary of all of your fantastic points. You're abruptly ending it on your last point, or you're ending it with something like, so yeah. That's my answer. If you belong to the last 2 groups, don't worry at all, because today we're going to be focusing on how you can give a fantastic conclusion to any answer. So what is a conclusion? A conclusion is a summary of your answer in around 15 to 20 seconds. And the way that you do that is actually completely up to you, but we have 3 variations that you could use. So let's have an example question. Let's say that you've been given an ethical scenario and you've been told to discuss the ethical issues involved. So you've given all of the points and now you approach your conclusion. How can you end it? So you can either end it on a basic note. So those are the ethical issues I would consider. Now this is quite basic because you're not really giving any specific terms or any keywords from your answer. And a lot of you guys will be doing this already. Or you can go a bit more specific by saying, so I would make sure to consider all of the ethical pillars in this scenario. So here you are openly stating that you are going to consider the ethical pillars specifically. And the final thing that you could do is end it on a triad. This means that you bring out 3 key words from your answer to summarize it. So something like, therefore, the main ethical dilemma to consider here is possibly breaching the pillars of non-maleficence, beneficence, and patient autonomy. This is called the conclusion of triads, where you bring in 3 specific keywords from your answer to form your conclusion. And in this case, we brought the 3 ethical pillars of non-maleficence, beneficence, and patient autonomy just to summarize our entire answer. And that's all you really have to do. Just bring in 3 keywords into your conclusion and then you have your conclusion. Now as you master this triad format, you can begin to embellish your conclusion with an additional sentence if necessary to really bring out any other unique points that you might have had in your answer. So in addition to what we've just said, therefore the main ethical dilemma to consider here is possibly breaching the ethical pillars of non-maleficence, beneficence, and patient autonomy. I would also like to consider any psychological and social issues that the patient might have. In this way, by doing the triad format and also having an additional sentence if necessary, can really summarize all of your points in around 15 to 20 seconds. So there you have it guys, 3 variations of conclusions that you can use for almost any answer. As long as you are specific in your summarizing, bringing 3 keywords from your answer into your conclusion, then you have the perfect ending for any answer. So if you want to put any of these interview tips to use one-to-one for very affordable prices with either myself or another one of our excellent MedCell tutors, just send us a DM on medcell.academy. But for now, I'll see you in the next video. Bye.